Hey everyone, it's Nurse Nikki and it is Women's Health Wednesday. It is also Breast Cancer Awareness Month. So we about to talk about checking these breasts. Everyone should be checking their breasts, their mammary glands, all right? Male, female, whomever, I need you to check it. Yes, men can have breast cancer, okay? It is a thing, and I want to be super vigilant about checking, not to the point where you're nervous or anxious or it gives you anxiety, but just to check, okay? So this is TT, the Tata, and we're going to use her to check to learn how to do a self-breast exam. So when do you do your self-breast exam? I want you to do it not necessarily around your period, okay, because there are breast changes during that. There's tenderness, there's extra lumps and things that are just normal hormonal changes. I want you to do it about 1 to 2 weeks after your period, okay? The best time to do it, I want you to do it in a couple of places. I want you to do it in the shower, so your hands can easily glide over your mammary area. And then I also want you to do it lying down, because then we can have a better view of different other things against the chest wall, okay? Now, I want you to go in this area all the way up in here, okay, in your armpit, because that's the area where we can get some lumps as well. So how are we going to do this? We're going to go up and down, okay? Going, feeling down all the way through your breast, up and down in a vertical motion. Then I want you to go horizontally, okay? I want you to create a grid. Then I want you to swirl all the way around. And I want you to make sure we also put some emphasis on the nipple. Squeeze your nipple. How does it feel? And then I want you to go like a star. So we go in like this and kind of like a wedge, I guess, star, however you want to call it. I want you to feel your breast. I want you to make sure that you're doing this every month. Some people put reminders in their phone. Sometimes their app, with your period app, sometimes it'll remind you to do your self-breast exam. It's really, really important, especially among African-American women where we get a more aggressive form of breast cancer. Another thing is know your risks. Ask your family. Ask them questions. This is not something that we keep as a family secret. This is something that we share because it can save lives. Consider, if you're a woman of reproductive age, consider breastfeeding. People's like, well, I don't want to breastfeed. Hey, breast milk can save lives with breast cancer as well, okay? Decreasing your risk of getting breast cancer. I'll tell you, I did breastfeeding for a very selfish reason. Several people in my family have breast cancer, and I know that I have a very high risk. I started having mammograms at age 16. I had my first lumpectomy at age 22. I've been getting mammograms, and I decided, you know what? I'm gonna breastfeed my babies. Let's see what we can do with this risk. All right. So that is something that I did. That is something that I encourage you to even think about. I'm not going to push you to breastfeed, but I do want you to consider it. Consider all your options. A lot of times we think of it as just something for the baby, nutritious drink for the baby, but it is something truly, truly beneficial for the mother. So think about it, learn about it. If you have any questions, please let me know. I hope y'all have an amazing day, and don't forget to check your breasts. Bye, y'all.